Health remains one of the major pillars of Governor Babajide Sanwo-Olu's administration. As portrayed in his Themes Plus agenda, the governor places priority on the well-being and healthcare services provided to Lagos residents. As 2023 sets in, 53 people, mainly children, benefited from the Lagos State government-sponsored free limb deformity corrective surgery and rehabilitative program. The intervention is to alleviate the suffering faced by children with limb deformities, improve their self-esteem, and offer them a chance to function in the society.
So I saw a lot of people who we had operated on and are recovering, and some are still in surgery right now there. And we can only imagine what impact it would have on their lives. This is not a one-off. This has started since 2007, and it's something that we do in stages. We screen lots of people. Some are eligible for this surgery because in an outreach like this, you can only really do minor surgery that someone stays maximum one night and then goes away.
Each kind of deformity requires a special kind of specialist to be able to provide interventions for them. We are focusing on lower limb deformities. Okay, and then these come in different categories as well, so which is why we do a screening previously. We have hundreds and hundreds of parents come with their children to come and see if they would qualify for some of those surgeries. But we know that some of them have, underlying nutritional issues like calcium deficiency, which would, of course, cause some of those deformities to occur. So part of the things that we're also doing is providing nutritional interventions for some of those children who have calcium deficiencies to be able to correct that first, and then we can now embark on surgeries to be able to do the limb lengthening and correct the deformity. And so the state is trying to support our people, especially in these times where things are even a lot more difficult, to be able to allow for those interventions to take place for them free of charge for the patient at the cost of the government.
We pray Almighty Allah continue to be strengthening them, the government, the organizers, and the doctor.
I'm so happy. I don't even know how to say it. I'm so happy and I'm so grateful for what happened now to my daughter, because I will not say how much I've already spent before I know this Hello Lagos.
The operation was successful. We are happy. I'm very, very happy.
As part of measures to deliver quality healthcare services to Lagos residents, Governor Babajide Sanwo-Olu inaugurated 6 medical infrastructure projects at the Lagos State University Teaching Hospital, LASUTH. They include a 124-bed SDG multipurpose medical building, the renovated House Officers' Quarters, the Faculty of Basic Medical and Clinical Sciences building, an ambulance bay, a special services center, and a sports complex, all located within the premises of the LASUTH complex. Governor Sanwo-Olu also broke the ground for the commencement of construction of 11th-floor resident doctors' quarter, which when completed would have a 30 units of 2-bedroom apartments and 63 units of 1-bedroom apartment, including ancillary facilities.
We are here today at LASUTH to celebrate the delivery of a modern medical infrastructure that will further strengthen the capacity of our healthcare system to meet the needs of our people. With this facility and several others that have been put in place in other parts of our country, that are part for improving our nation's human capital development index and achieving one of the set targets under the United Nations Sustainable Development Goals.
This edifice stands out and will take care of all Nigerians living in Lagos. I'm aware that not only those who have been in Lagos are coming to receive treatment in LASUTH. In fact, not only in Southwest, we have people coming from other parts of the country to receive treatment here. And that's the reason why we need to do this and many more for LASUTH.
We have some wards, especially surgical and medical wards. We have private wards, in which we feel that certain individuals will want to use for their privacy. Then we have super executive private wards. Now this is the most exciting part of this building.
What we're about to demonstrate today are significant infrastructural changes that are going to enhance the complete cycle of healthcare delivery to Lagosians, encompassing training of medical and other allied health professionals. In this day and age of brain drain, this is a significant responsibility and function of LASUT.
The Lagos State government also signed a memorandum of understanding with resident doctors to ensure patients at various medical facilities get uninterrupted services.
The NAD executive NOC, they met with the federal government, so they sat down and they deliberated on each of the demands at the national level. And of course, because of the agreement and timelines, attached to each of the agreement, so NAD felt that at least as at the federal level, there has been some little progress. So we suspended the strike so that we are going to review it when we meet at the May OGM. Our agreements, many of them, they have timelines. So we'll now see how the government is going to work with the timelines. And as I said, our OGM will start in a week's time. So we will review whether what government have said it's by mouth or they are going to walk the talk. So, but when we meet at the May OGM, we will see what will happen then. So we will decide on what to do.
In line with the state goal of eliminating HIV by the year 2025, the Lagos State AIDS Control Agency, LSACA, organized various intervention programs to achieve the set goal, some of which includes the release of a domestic resource and mobilization plan to achieve a systematic and well-coordinated approach to increase public sector input into the budgetary allocation and execution of HIV response, training of traditional birth attendants to help in coordinating the control and prevention of spreading HIV, a 1-week statewide free testing services in hard-to-reach communities in the 20 local government in Lagos.
All the efforts Mr. Governor is making. We have about 98 ART centers where you will go free antiretroviral treatment. We have about 288 prevention of mother-to-child transmission centers. Look at, we're upgrading every day.
We are all here today to acknowledge the vital roles that communities play in the joint efforts towards stopping the spread of HIV/AIDS. To end AIDS, we must support community-based systems and structures at local level that creates networks and encourage people to take responsibility for their health. As we commemorate this World AIDS Day, let us recommit ourselves to the fight against HIV/AIDS. We must break the stigma and discrimination associated with this disease, ensuring that everyone affected receives the care and support they deserve.
I passionately appeal that community leadership engagement be made the core focus in all HIV programs designed and their formulation, budgeting, implementation, monitoring, and evaluation.
The Lagos State HIV response mobilization and sustainable strategic plan for 2023 to 2025, and this was developed to contribute towards achieving the vision and strategic goals of the the state HIV response strategic plan for 2022 to 2025. And the vision is just to seek and aid free Lagos State with zero new infection.
In the year under review, the Lagos State government, through the Ministry of Health, also began the administration of free drugs for the treatment of elephantiasis in children and adults in the state. These free drugs were administered to children from 5 years and above.
Nigeria still bears a heavy burden, accounting for 25% of Africa's NTD cases. In fact, all our 774 local government areas in Nigeria are endemic for one or more of the NTDs, putting over 120 million individuals at risk. As we recognize the importance of human resources to Nigeria's economy, it becomes crucial to address these diseases and improve the well-being of our people. Our goal is to treat 3,952,904 individuals, achieving 80% therapeutic coverage and 100% geographic coverage in the 6 identified LGAs.
The Lagos State government also launched the reviewed Essential Medicine List, where the Permanent Secretary Ministry of Health, Dr. Olusegun Ogboye, explained that the initiative will form the fulcrum for the treatment of various medical conditions prevalent in the state. A 3-day capacity building workshop was also organized for healthcare workers in Lagos Public Service as part of the year 2023 State Continuing Medical Education Program.
Topics that are medical and also topics that are about lifestyle, just to ensure that we can, because we consider that it's not just knowledge about medicine that the health workers need to be able to provide quality service. They need to understand lifestyles, and then we need to care for the carers themselves. We need to teach our health workers how to pace themselves so that they don't get burnt out in doing their work.
I expect that at the end of today, all the healthcare workers will go home impacted. All the healthcare workers will be more enriched. New best practices in medicine will be learned. And at the end of the day, we will have an excellent and improved healthcare service delivery for the good people of Lagos State.
During the year, the state government also supported hepatitis patients with vaccination and treatment to mark World Hepatitis Day.
Key things is to prevent it, and through education. So we're doing a lot of education and engagements with the communities and all stakeholders to ensure that information about the prevention, about the treatment is available. And as you also heard here, we had a stock of vaccines, which wasn't enough to vaccinate the whole state, so to speak. And so we prioritized health workers.
Hepatitis B and C are both important because they become long-standing, chronic. When they become long-standing, they can now lead to scarring of the liver, liver cancer, and liver failure. So because of that, they are the most important cause of liver disease worldwide.
Governor Babajide Sanwo-Olu also appointed 7 permanent secretaries in the health sector of the Lagos State Public Service. The appointees are mainly medical officers selected on merit from the pool of successful candidates in the executive development and screening exercise held in April 2022.
It's therefore very important that you see this appointment as a recognition and an acknowledgement of your performance over the years and your impressive result in the competitive selection process that was carried out several months ago. My expectation from you, and indeed the expectation of all of us being Lagosians, is to be at your best at all times. Because of something we are seeing in the education sector, we want to take it to the health sector. And we're open. Other sub-nationals, other states can come and copy us. We'll tell them what the model is, we'll tell them how we got through it, and we'll tell them what are the things that they need to do. Outside of the fact that our health professionals are one of the best in the country, we also need to give them strong administrative skills to ensure that they can also excel in those positions. And so we thought through this, and we said one of the ways in which we can unbundle and untangle the health public is to decompose them into 6 different districts, where at each of the districts, right, a permanent secretary, a medical permanent secretary is known as put at the head of affairs.
The Lagos State Blood Transfusion Service commemorated the 2023 year's National Blood Donors Day. The Executive Secretary, Dr. Bodunyo Shikumaya, highlighted the agency's remarkable achievement in advocating for safe blood donation.
Blood safety, we can assure you that at the Lagos State Blood Transfusion Service, every unit of blood that is transfused is 100% safe. How do we determine the safety? Blood safety starts from the person that collects blood from. So it must be from a voluntary blood donor. So voluntary blood donors are safe. Apart from that, even if the person is not a voluntary blood donor, the donor is assessed by different eligibility questions, and then we do some pre-donation tests like the hemoglobin level, we check for the blood pressure, we check for the pulse rate, the temperature, all those things to ensure that the donor is also safe.
Blood donation is very important because, as we all know, there is no substitute for blood. We can't manufacture blood, and blood is something that we actually use to save lives. In my practice, I'm an obstetrician, we use a lot of blood because pregnant women tend to have complications with bleeding. In fact, bleeding is the commonest cause of death among pregnant women. And once you are fit to donate, I mean, we are just taking a sample of a portion of your blood. We're not taking enough blood to depreciate the blood donor, and they'll still be able to go about their functions normally for that day. So we need more blood donors, more people to be involved in blood donation.
General advice given by the World Health Organization, where it's been studied that if 2% of the population can be recruited to be voluntary donors, we would meet the blood donation needs of every country of the world, generally, less than 2% of the world per country too. So that we should encourage people to see the value of blood and blood products in the health sector, where we practice and we see that patients' disease processes require that patients need to survive with blood transfusion. So that's the advice I give, that we need to continue to encourage people or recruit people in that manner to be voluntary donors.
The cost of preparing 1 pint of blood to give to someone, including the grouping and cross-matching that has to be done before it can be transfused to anyone, is a little too high for the public to bear. So what is happening currently is that the people who are screening the blood and the hospitals that are transfusing the blood are bearing the cost, the extra cost, and they're complaining now about that extra cost. So the blood transfusion service is working on finding a way to get government to pay that difference so that the heavier cost is not transferred to the patient, and that the healthcare provider that is grouping and cross-matching the blood also doesn't keep losing money for each pint of blood that they have to transfuse. So that's what we're working on what a fair amount is for the government to bear, and then to ensure that blood is still fully available and for people that require blood transfusions, and as and when that they need it.
In a bid to eradicate the menace of transmitted helminthiosis infection, the Lagos State government in 2023 commenced its third annual free school-based deworming exercise targeted at children between the ages of 5 to 14 years, enrolled and non-enrolled in public and private school in the state.
I want to thank Lagos State government for the good job they are doing to make sure that Lagos State is building a healthy community and healthy people for future benefit. We are doing deworming for school-age children between age 5 to 14 years of age in 10 local governments in the state.
I learned about the deworming exercise, ITNG, tropical disease. I learned that the deworming keep us healthy and remove the disease out of our stomach.
It's a very good thing because we stay most of the times with these children more than their parents. Many a times you see them coming complaining because stomach ache, this ache, because of the environment of where they are living. And with what they are doing today, it will go a long way. It will heal them. It will be able to deworm them very well. That all these minor diseases will stop from the children, that when they come to school, they'll feel very comfortable to learn.
With these interventions, the Lagos State government has reiterated its commitment to providing unfettered access to quality health services to all Lagos residents.